This is Healthcare Now Radio's Talking the Walk. Come along with us as host Tom Testa and his guests discuss the strides being made toward actionable changes in the industry. It's a fast-paced 30 minutes, so keep up. And now, here's Tom Testa.
Hello, everyone, and welcome to Talking the Walk. On today's show, I'm joined by Nitin Natarajan. He's the formerly Deputy Director of the U.S. Cybersecurity and Infrastructure Security Agency, or CISA, and now he's the owner and principal at NN Global. Nitin, welcome to Talking the Walk.
Good to see you, Tom. Thanks for having me on. Looking forward to the conversation.
Well, it's going to be a great conversation, Nitin. Can you please give our listeners a little bit about your background and what inspired you to bring you to where you are today?
Sure. So it's been a little bit of an interesting career pathway, or more of a zigzag, I think. I spent the first 13 years of my career as a first responder in New York, including service as a flight paramedic for a number of years. So had the opportunity to really see clinical care at the bedside and the impacts that disruptions to healthcare plays in communities across the nation. Also deployed to disasters all over the country with a response team. So, I've seen the need for healthcare when it's down during natural disasters, during things like 9/11 and other types of tragedies. So really being able to see the criticality of the healthcare system in day-to-day America, I think something that people don't like to often think about, right? It's just there until it's not. Went from there into public health, went into the federal government, worked at Health and Human Services for a while, working specifically with critical infrastructure owners and operators in the healthcare space, bringing the public and private sector together to figure out how do we build resilience, and not just in healthcare delivery, but across all of those critical aspects of healthcare that are needed for healthcare delivery to occur. Right, so medical manufacturing, distribution, supply, pharma, labs, blood, biotech, health IT, insurers, payers, HMOs, that entire spectrum. Spent some time on the National Security Council looking at critical infrastructure across all 16 critical infrastructure sectors. Went to some other federal agencies, spent some time consulting, and then most recently was at CISA, where we actually made healthcare one of our priority sectors for my last 2 years there because of what we were seeing in healthcare and had a chance to personally lead those efforts. So I've been able to see the transitions in healthcare, the impacts in healthcare, and frankly, the threats to healthcare over the last 20 years and see how they're evolving, and really why I'm so passionate about building more resilience in the healthcare space.
I want to dive in, Nitin, really into the heart of the conversation here, something I talked about at the beginning. You've warned that healthcare needs to think seriously about nation-state threats. Why should healthcare leaders treat this differently than just another ransomware problem?
I think the biggest issue really is the scope and scale of the attacks, the persistence of the attacks, and the complexity of the adversary, right? These are not individuals in their basements. These are not cyber criminal groups. And while there are criminal groups that are very robust and have a lot of capability, nation states are a completely different type of threat landscape. And we need to get over this bridge of a nation state isn't going to care about my hospital in the heartland, right? My little community hospital in the heartland. Nation states aren't going to care about that. They probably can't even find me on a map. And that's not true, right? We've seen nation-state actors continue to conduct attacks around the world, but also here in the United States against healthcare assets. So it's not just another ransomware actor that's looking to make money. It really is about disrupting the healthcare ecosystem and impacting the lives of day-to-day Americans. And it's that shift that really is concerning. I think it's also need to think about this on the scope and scale of the adversary, because we're asking small community hospitals to defend against a nation state actor, right? When they're focused on, making sure they have enough staffing, making sure that they have enough equipment, that their patient load is patients being managed effectively. And now on top of all of those day-to-day struggles that we see healthcare executives dealing with, we're saying we want you to worry about China, Russia, Iran, North Korea, which can seem extremely daunting, which is why I think there were steps and actions that organizations can start to take to help build some of that resilience. We're not going to prevent every single attack from a nation state. We're never going to help a community hospital defend against 100% of cyber attacks. But if we can build that resilience and that opportunity to bounce back and to continue care in that community, especially amongst rural hospitals, it really is going to allow that community to continue to be served, to lessen the impacts of those attacks when they happen, and again, allow patients to continue to be cared for in these communities.
Who are they targeting?
It's a combination. So it's no longer just large healthcare systems. It's no longer just government agencies or large cities. We're seeing attacks across the nation. We're seeing attacks in small community hospitals. We're seeing attacks against K through 12 schools, in the heartland. So I think as we look at that, it really is that change in what we're seeing as far as victims. So it's not We need to get out of the thinking of, I'm a small community hospital, I don't have to worry about it. Every entity has to worry about it. And frankly, it's not just hospitals. right? It's also making sure healthcare distributors and manufacturers are looking at this, making sure that private physicians' offices are looking at this, as well as we look at the interconnectedness of the ecosystem right now. As you look at things like electronic health record systems and others, everything is connected. And as we know, our adversaries for decades, their MO is to really try to figure out what is that weakest point of entry into these networks and into these interconnected systems. And often it's not the large organizations that have the resources, have the staff, have the money to be able to invest in strong cybersecurity. It's those smaller entities that they're able to tap into. And we've seen this type of tactic in the defense industrial base and in other places where you look for that weakest link, and that's your entry point. And once you can get in, you have the opportunity to spread. And so we really need to build that resilience across the entire sector in order to make everybody safer and more resilient.
That makes perfect sense. So kind of expanding on that a little bit, when a hospital ransomware cyber attack, when does it become a national security issue? You worked at several national organizations. When does it become a matter of national security?
I think it's relatively quick, right? I mean, I think when you look at how you want to define national security versus homeland security, a lot of the impacts, especially when we look at rural America, losing one hospital can cause chaos in a community, right? If we are forcing patients to drive potentially hours to seek healthcare, it's going to have an impact on the lives of day-to-day Americans. And so we really need to see this as a national security threat. We need to see this as a patient safety issue. And as we look at the tactics changing with our adversaries, right, a lot of the targeting is impacting senior citizens. We're seeing targets against, again, healthcare entities. We're seeing the living off the land techniques that we're seeing the PRC use, where they're pre-positioning on networks of critical infrastructure owners and operators and just sitting there, right? So they're not causing any disruption. They're going in, they're sitting there dormant. And to be able to act at a time of their choosing, right? So we don't even know where some of these actors are. So there could be actors on networks and systems of healthcare organizations today that are just sitting there, right? And waiting for a time when the PRC would want to cause broad disruption across the United States and to have that impact. I think the other big thing when we look at this is that it's a matter of trust. People always see hospitals as a place of trust, as a place of safety, a place to go when they're sick, injured, when their family needs care. If we remove that trust, where do you go? Right. And I think that trust is a huge issue as well. And so when we look at that national security landscape and how do we as a nation, maintain our security effectively, all of those little opportunities that these actors have to dig away and chip away at this through our healthcare ecosystem will impact our ability to maintain strong national security, which is why we want to put such a strong focus on it.
And not to get off track, I know I have a whole bunch of questions for you, but just being even a healthcare consumer, we're looking to get more connected, more digital, more technologically advanced. So, get away from the paper, get away from all that stuff. So it almost seems like we're creating even more of those target points than even before. Is that correct?
Definitely. And I spent some time as a hospital administrator for a while as well. And, technology is great. I look at, I left the hospital 21 years ago.
Yep.
So when I look at where technology is today versus where technology was when I left, it's amazing and it's wonderful and it's doing wonderful things. But I think as we look at this, again, each point of technology opens up a new pathway for an adversary to wreak havoc and to cause harm. So these are good things, but it's also making our resilience much harder. One of the things I often hear when I talk to healthcare organizations is we go back to paper. We have a plan, we go back to paper. We just go back to paper. Don't worry about it. We go back to paper. And I said, that's great. And 20 something years ago when I was a clinician, we were starting to do electronic health records, right? We were starting to go to electronic systems. I was raised on paper and I was kicking and screaming brought into electronic filing. Today's clinicians were never taught on paper. Today's clinicians have only worked with electronic systems. They've only worked with PACS. How many rooms in hospitals even have light boards to put up films anymore, right? To read films. And that's a great thing, right? This is a good thing for healthcare, but it also makes that reverting back to paper harder because we need to train clinicians on how to do that. And I've talked to organizations that have said their patient throughputs decrease significantly when they have to go back to paper. The potential for patient errors and increases when you don't have that technology providing some of that check and balance. And that's not a knock on our clinicians. We have amazing clinicians in healthcare organizations throughout the country, but we have become dependent upon the technology, and again, understandably so. But so that reverting back to paper, that resilience becomes a little bit harder, which is why we need to do it. We need to focus on it and do it with intent.
That's a great point. That's a fantastic point. Just going back to paper alone would set the healthcare ecosystem back if we had to in some way because of dealing with an attack or something like that. So that's a fantastic point. Thinking about the this generation of healthcare providers that are just grown up on technology, you know?
And that's healthcare delivery at the bedside, right? That doesn't go into everything from,
That's right.
the warehouses and the storage of medical supplies and the inventory of medical supplies and pharmacies and pharmaceutical, like all of those things that are also dependent upon electronics for that clinical care to happen. All of these entities have depended upon technology in a great way, but going back to paper becomes even harder.
No, you're right. Well, let's talk a little bit about that technology, especially AI in particular, of course, that's just dominating the healthcare landscape, all landscapes, in fact. You've coined the phrase deploy AI with intent. I love that phrase. What does that mean in practical terms for healthcare executives, deploying AI with intent?
So to me, it's two-sided, right? So one is obviously the vendors being more transparent about their embedded AI and how they're using AI. But on the executive side, it really is about healthcare executives asking the right questions about what technology they're implementing within their organizations. It's about buying software that asking the questions of what AI is embedded, if it is, how's it being used, where is my data going? A lot of those other things. I was at a healthcare conference where I talked to all these vendors that had AI tools. And they kept telling me, this is going to save you time, it's going to save you money. I'm like, that's great. Tell me more, right? Tell me more about how your models were trained. Tell me more about my data privacy and where my information goes. And nobody could answer those questions. They just kept saying it's going to save you time and money. And I'm sure that's true, but we need to ask those deeper questions. And there's some great guides out there that folks have created to give the non-technical community a list of those types of questions to really ask to learn more about the AI that you're implementing. And the other thing we've seen organizations, I heard from a healthcare organization where they found out after the fact that a lot of their information was used to train a tool that was then deployed over into Europe,
Mm.
causing potential issues, right? Because now you have US information sitting in a foreign country and a lot of the challenges that come with that. So asking those detailed questions and really understanding what you're buying, to me, is what I call deploying AI with intent. And again, it's not to say we shouldn't be using it. AI is an amazing tool, but we need to know how we're using it. I think especially in healthcare where, the potential consequences of the leaks of PHI are significant, the potential impacts on clinical decision making, those types of things, right? Where is the human in the chain? And do you know where that human is in the chain? And are you okay with that? I mean, you're okay with X amount of information or analysis and decision making being done in an automated fashion? Again, I'm not against it, but we just need to know what we're doing and what we're implementing. And this is where I think executives can really make a difference, is by asking those questions and not just going for the shiny object, but asking the questions and getting the shiny object that's going to make their organization better.
If you're just tuning in, you're listening to Talking the Walk on Healthcare Now Radio. I'm Tom Testa, and joining me today is Nitin Natarajan. He's the former CISA Deputy Director and current principal at NN Global. Nitin, I want to continue this AI discussion here again with you. Let's talk a little bit about shadow AI and embedded AI, and I'm about to learn a lot more from you. Hearing the word shadow AI, even that alone gives me the chills a little bit. But I'm about to get educated. Employees are using it. Vendors are embedding it, kind of what you talked about a little bit. Most organizations aren't governing it well, which is a huge question. I still don't know where the regulations are around this, accreditation, things around AI. Where's the real risk in all this?
I think there's a risk in both. So as we look at this, embedded AI obviously being what software developers are utilizing AI, but maybe not being as transparent about it, right? So you're using tools and capabilities and services that are using AI. You just don't even know that AI is embedded in these tools. So you're benefiting from it, but you're not fully aware of the risks that you're facing. Shadow AI really is employees utilizing AI to make their life easier, right? But not in a way that has been sanctioned or approved or recommended by the CISA or by the IT department within the healthcare organization. And I think as we look at AI, it's very easy to say, I can save a lot of time by putting information into X or Y platform and give me feedback. But what happens with that information? So one of the things that we saw in the early adoption of LLMs, people were taking their emergency management plans and saying, put these together and either give me consolidated plans or tell me where there's gaps or tell me how I can improve these plans. I'm required to update my plan every year, every 2 years, depending on the sector. And I can use an LLM to do that and save me an immense amount of time, given some of these plans are hundreds of pages. But where did that information go? And what sensitive information do you have in your emergency plan about potential vulnerabilities in your organization, about your risks that you were worried about in your organization, and where have you put that information now for a potential adversary to get access to, and to be able to use that against you? So I think as we look at this, the use of shadow AI, while it sounds great and convenient from the employee perspective, we need to look at controlling that from an organizational perspective and really put arms around that and say, how do we deploy AI in a way that allows us to utilize the efficiencies it's going to grant us in our organization while also protecting that information? And when we look at healthcare organizations, we have the risk of loss of confidential information, PHI,
Mhm.
is definitely out there. The introduction of new vulnerabilities, so people who are vibe coding and people who are now software engineers that, yesterday couldn't spell software engineering, right? And so, are
Yeah.
these, and I've talked to a lot of my friends who are software engineers, and they said, the problem with a lot of this coding, again, it's helpful, but some of it is not accurate, or some of it introduces vulnerabilities, or some of it has issues. So you still need that technical expert to be able to look over it and be able to say that, this is okay to use. But people are doing that because it's easy, it's making their life easier, but you're potentially introducing new vulnerabilities into your network. And I'd offer the third piece of this is really just wrong answers, right? We still have this philosophy that AI is infallible, that AI is always correct, but AI is also drawing sixth and seventh fingers on people, right? AI is still providing wrong answers. And we're seeing a huge increase in the people in individuals using things like ChatGPT and other tools as their physician, right? Asking medical questions. And I see examples on social media all the time of people getting incorrect medical answers back. So as we look at the use of shadow AI, if people are using it for certain types of questions, you may not get the right answer. So I think we have that dependence on a certain level of presumed accuracy that isn't there yet, when we deal with AI, depending on what model we're using and how we're using it. So having the ability to control how AI is being used in your organization is going to allow you to prevent some of these things from happening.
So who's monitoring this? Who's overseeing this?
I mean, that's what it's a little bit of the wild, wild west right now. So we
It
have,
is.
the federal government is looking at what role they should play. Obviously, states are looking at regulation. Foreign countries are looking at regulation, especially as we look at healthcare being kind of global, especially when we get beyond bedside delivery,
Mhm.
the devices and everything are kind of a global ecosystem. So everyone's trying to figure out, how best do we regulate this? How do we deal with transparency? How do we do this in parallel to some of the other efforts, right? So there's efforts on secure by design, efforts on software bill of materials, other types of tools to enhance transparency, to enhance a focus on security first and not security last.
Mm.
And so I think all of those efforts together are going to help slowly build more of that resilience and more of that security in the use of AI in healthcare. But it's going to take some time, right? I mean, the technology is evolving so quickly, and the introduction of new hardware and software is happening on a daily basis. Until those guardrails are in place, we need the end users to have that, I'd like to say, a higher index of suspicion, like we do, with patients in healthcare, about what they're putting at the bedside. And I think as long as we can continue to push on that front as well, we'll get to that point where we have the transparency, we have the security, and we can do more rapid adoption over time. But I just don't think we're there yet.
Let's talk about PHI. You mentioned it a few seconds ago too, and now I've seen many reports showing how year after year it's getting PHI on the dark web is more valuable than credit card data, than your or my credit card data. How does AI, all this, amplify that risk?
I think it's just, it is the most valuable, right? We've seen it bring in more money than driver's licenses, credit card information, even passports at times. So it is what adversaries are looking at. I think that they're making money from it, right? At the end of the day, this is about making money. They're making money. So I think from an AI perspective, it really is about how much more data can they get access to, right? I mean, the more I have to sell, the more money I make. It's as simple as that.
Mhm.
So there's obviously use of AI tools where people are uploading medical records and getting second opinions and even, X-rays and MRIs and other types of scans and that type of capability. There's still the potential for phishing applications and getting into a healthcare network and the opportunity to do mass exfil. And again, hospitals have systems in place to monitor, exfil. And I don't want to give people the impression that this stuff is not monitored. It definitely is out
Right,
there,
right.
but things can slip through the system. And so, the exfil of that type of PHI is there as well from ransomware and from simple phishing emails. And people still believe somehow, I don't know why, people still believe they'll get $1 million via email, right? They still believe if they click that link that they're going to do it. But again, AI has made phishing much harder, right? If we look at phishing emails from 5 years ago, you could easily tell it was fake, right? It was broken English and the graphics weren't right and the syntaxes weren't there. But with the use of AI, you can be a native speaker in any language in the world, right? And so you can make your documents and your websites and these things look much more accurate. So AI is speeding up the ability to do those types of attacks as well. And when you look at healthcare executives, I mean, everybody's working, 80 hours a day and 8 days a week. So it's the end of your day. You have 30 emails left in your inbox. You're looking to clear the inbox. Something comes up. You click on it just to try to work through. So, these things can happen inadvertently. These things can happen even when you are cyber conscious and you're paying attention to it because we're humans and humans do, make mistakes. So I think from that perspective, it's AI is going to make it easier for adversaries to conduct some of these attacks to be able to pull that PHI, which again, the more PHI they have, the more they can sell, the more money that they make at the end of the day.
That's important. Like, I don't think we forget it, but it's interesting that you mentioned that. Like the bad guys have the resources too. Not just the good guys, the bad guys have it. And that becomes a huge challenge for especially the consumer, because the healthcare systems, total faith, they're on top of it. They know what's coming. It's most of us consumers are probably that weakest link, to be honest with you.
Yep. And especially, I just make a quick plug. I mean, a
Yeah.
lot of the attacks we're seeing in the cybercrime space are against senior citizens,
Yeah.
right? We're seeing so much, cybercrime against targeted senior citizens happening in long-term care centers, right? People targeting long-term care centers as a way to get to senior citizens as a means to do that. So I think, the adversaries know who they want to attack. They know how to attack, and they're using AI now to help them in doing so.
Then you describe risk. I've heard you talk about this before as a three-legged stool: identification, mitigation, and acceptance. Why is risk acceptance so important in that three-legged stool?
So it's critical. So I think what people forget is that we spend, as you said, a lot of time on risk identification and risk mitigation. We
Mhm.
forget if you identify it and you choose not to or cannot mitigate it, you're accepting it. But we don't look at what we're actually accepting. And we'll never mitigate all risk, right? We walk out of our house in the morning. We hope we don't fall down the stairs, right? I mean, we accept the risk, we give it a shot, and hopefully we're successful. But we need to be eyes wide open on the risks that we're accepting, and I offer we're not, right? So we identify our risks, we say we've mitigated X and Y, but we have then accepted these other risks that we've identified, and people don't want to do that, right? It's scary. It's scary to say that I am accepting a risk in my organization of X or Y. That has a potential consequence of, either economic impact or operational impact. But we need to look at that risk acceptance. We need to be eyes wide open in what we're accepting in our organizations in order to really come up with the multi-year plans on investment to be able to respond when resources become available. In government, that was one of the things we always looked at is where are our risks? And if, funding becomes available in a fiscal year, how are we then able to go in and target that? But we can't just be blind to it. And we need to look at that risk acceptance, not just amongst our CISOs, but frankly amongst our CEOs and our boards as well, right? I mean, the CISOs in our organizations accept a certain amount of risk, right? They make decisions every day on security and safety. So this is not to take away from their authority, their capabilities, or expertise. But at the end of the day, from a corporate perspective, that risk acceptance resides with the CEOs and the boards. The CEOs and the boards are making determinations on where investment needs to go, whether the money goes into, part A or part B, whether the money goes to this department or that department. Those decisions are not made by the CISOs. Those decisions are made by CEOs and boards. We need the CEOs and boards to be better informed on the risks that are being accepted in their organizations based on current investment, based on current capabilities, based on current technologies, so that they can be eyes wide open. Right. I mean, we really need more of that transparency. We need more of that CEO and board engagement, specifically on risk acceptance. And I think we're getting much better than where we were. I've been on panels with healthcare CEOs from large healthcare organizations talking about their attack surface. Right. When I got into this space, almost 20 years ago, CEOs were never talking about cybersecurity, much less talking about their attack surface. But now to have CEOs of large healthcare systems say, I know my attack surface is expanding, I know I need to take these steps, really is a lot of progress. And it's wonderful. And I think it's a great thing that we are seeing. We need to do more of that. And again, not just in large healthcare systems, but even in smaller healthcare offices, in clinics, and those types of organizations that don't have huge executive staffs, but have people who can dedicate some time to it.
So let's talk. That's a great. I've got one final question. That's a great segue here, and it really involves those community hospitals, those rural hospitals. If you were advising a healthcare CEO heading into the rest of this year and even beyond, with limited resources, what are the top 2 or 3 strategic moves they must prioritize to build true resilience?
I think it comes down to a couple of things. One is what we've been talking about through discussion today really is about understanding your risks, right? Spending the time to invest in understanding your risks internally, but also your third-party risks, right? There's a lot of third-party risks that we adopt in our organizations when we bring in new technology, when we outsource to a vendor. Understanding that third-party risk really is essential. And I've seen cases where we had an organization, not in healthcare, in another sector, that was using a third-party vendor to do a lot of storage of data. And the servers of this organization were moved to China without telling the client that they were moved to China. So they were US based, and then they moved. Do your contracts allow for that, right? Do your contracts require people to disclose that type of information? So being able to understand those third-party risks, how your contracts are delivered, what vendors you have, what security efforts they're taking is critical. So understanding your risks is one, both internally and third-party. I think the second thing I'd offer is take action. Right. I think people often think of cybersecurity as a light switch, and people are so worried about, I need millions of dollars and I need to hire an entire department, and I can't do anything until I have this entire team to move that light switch. What I would offer is that it's not a light switch. It really is a bank of about 100, maybe 1,000 dimmer switches, right? And every day there's something you can do in your organization to move a dimmer switch up in a vertical direction. And I kind of jokingly tell people, whether that's ripping the password that's written on your keyboard, right? Taking that piece of tape off. I've seen people put it under the keyboard, not really a lot safer. But each of those things is a step in the right direction, right? And so there's something we can do every day in our organizations, both as individual people and as users, as well as network administrators and executives within our organization. So move a dimmer switch up every day. And every day as you do that, you're going to build more resilience in your organization. So don't think of it as a light switch. Think of it as a bank of dimmer switches. Do something every day in your capacity within your healthcare organization to move that dimmer switch up, and you're building resilience. That's all it takes. You don't need the big, shiny magic element. Just do something each day, and you're going to build resilience over time.
That's great advice, and great advice even for those not even in the healthcare sector. That's just great advice in general. I love that, Nitin. And thank you for joining me today. This has been insightful conversation for one, and I definitely would love to have you back.
Thanks for having me on. I'd love to. It's something I'm extremely passionate about. So.
No, this has been great, Nitin. Thank you so much. If you'd like more information on NN Global, visit their website at nnglobal.us. You can also connect with Nitin on LinkedIn. Thanks for joining us today on Talking the Walk. Tune in to hear us weekdays at 8:30 a.m., 4:30 p.m., and 12:30 a.m. Eastern Time. You can also find all of our episodes on the Talking the Walk program page on healthcarenowradio.com. If you're walking the talk, we want to talk to you. Connect with me on LinkedIn or by filling out the show's contact form on healthcarenowradio.com. Until next time, keep walking your talk. I'm Tom Testa. Take care, everyone.